Mike here. It's 10/3/2024, and we're going to be looking at some fantastic exhibits from Anatomy Trains, Myofascial Meridians for Manual Therapists and Movement Professionals by Thomas W. Myers. I also have my YouTube channel, Living with Connective Tissue Disease. I suggest you see that. It's not easy to find when you search it under that name. You got to look down about 30. Clinical evidence of connective, plenty of photographic evidence. Of what you see here, this is a cadaver of all the interconnected tissue that involves the lateral lines. It's quite obvious. My lateral lines are quite bad. It's evident in the photos. It's evident just upon examination. And of course it impacts interconnected tissues all the way down to the bottom of the feet to the toes, up to the neck. Okay, so when we're looking at these diagrams, of course I did see orthopedics, podiatry, and they tend to focus on the problem, the foot, but it's all interconnected. We're going to be looking at a table actually that lays everything out pretty good. I've had a lot of problems. Oh, right here. You can see that in the photo. My glute's gone. And you can literally see the lateral line going straight up the side of the leg. I mean, it's so evident that my lateral lines are extremely messed up, okay? And they are also, so they're responsible for the tremendous amount of foot pain I had until I started elongating all my tissues for a couple of years and taking some of the pressure off. So I do not have peripheral neuropathy, okay? And then, of course, I had cervical pain diagnosis. Well, this is where it came from, okay? I even at that spot, yeah, it is something else. So when you get a neck pain, it may have nothing to do with the neck. It may have to do with the interconnected tissues that run from your feet to your neck, all being in chronic contraction state or not contracting and releasing properly. All the findings are evidence of connective tissue disease, okay? I had a lot of lumbar pain for a while because of compression. All these lines of tissue running from your feet to your head are chronically over tight. They don't release. They don't function properly. You end up compressing all of your joints. It's a real problem. So this is where not allowing the condition to get out of control and doing a lot of time with rollers on the mat and a lot of time purposefully, I can't pronounce that for some reason this morning, elongating the tissue. Here's another right there as far as the spine goes, side to side. Yeah, this is awfully tough to do a video and actually discuss in depth the problems that I am having. But I'll tell you, this book, I highly recommend it. I don't care, if you're, retiring and you know what, you need to learn on what to maintain. Look at this chart. The bony stations, the tissue, the cadaver, you get the postural, the movement function, very basic outer stabilizing system to prevent buckling problems that I've had. I mean, it's like so obvious, okay? This is actually what you're seeing as far as illustrations. This is what would be used in the court, okay, for medical damages. And it would be as simple as having a manual therapist confirm this. And of course, with a physiotherapist or physical med doctor, it would be really easy to confirm this stuff. Okay, this is all soft tissue problems. Okay, We're not even talking needing all kinds of MRIs and X-rays or CAT C scans or whatever. Okay, it's quite clear what my problem is. This book is fantastic. I can't highly recommend it enough from anybody in sports. I mean, if I had this when I was a wrestler, when I was a young lad, or a martial artist when I was younger, let me tell you, it would have gotten me to the next level, just like it got me to the next level when I bought this book a year ago in my physical therapy. Okay, because you can actually see what you experienced, feel, and deal with on a daily basis. So I hope this is going to get you on your way to understanding. This is just one of my problems. Both left and right lateral lines. You can even see where it connects to the back of the ear, that if I had any visits where I went to the doctor, I had ear pain, all right, and there's nothing going on, you know what? That's my lateral line pulling, okay, pulling and impacting all around the ear there. Everything that I've had can be explained from the perspective of connective tissue disease, and there are other lines, like a deep front line. I have massive problems with my deep front line, okay? I'm going to try to keep this short and simple. This is no BS. No, this is not delusional thinking. This is not mental illness. This is reality, folks. Reality, okay? Get that through your heads. Michael has connective tissue disease. You can see it, okay? It's remarkable. It's very quite can be seen quite easily. Can be confirmed very, very easily, and the symptomology never changes. I can manage it, but if I go back, if I was to just say, okay, I'm not going to manage my situation, I would be a wreck in no time, flat. Okay. In fact, when I go to see finally since 2000, since I've been basically stonewalled from getting any type of treatments. Okay, when I do see a physical not a therapist, a physical med doc again, I'm going to simply ask the question: do you want me symptomatic, or would you like to see me just, not symptomatic, everything managed? Okay, maybe we can do one visit where everything's managed, and we can do one visit where, well, the symptoms are out of control. And it wouldn't be too easy for me to make them out of control. I just try to live like a normal person for a couple of days. Stay up and around too much, do too much, maybe cook a few meals. In other words, be up and around, and don't lay down, don't rest. Just let me tell you, in a couple of days, my body will be so pissed off. You're going to need a second person in the examination room to hold me on the table. Okay? Yeah. No bullshit. I'm tired of this bullshit. It's got to stop. It's got to end now.
With the intercostals, neck, space, and sternocleidomastoid, all together form the basket beam on the outside edge of the body. Okay, with those general considerations in mind, let's get down to the specificity of the lateral line being. We're going to review the anatomy briefly. The anatomy thoroughly reviewed in Team 2 of the series, Anatomy Training Overview. But now let's just look at the tract locations that comprise the lateral line, which include muscle attachments and retractable myofascial soft tissue articulation. Our first station is on the medial and the lateral side of the foot. You can see the base of the first metatarsals, the peroneal tendon, coming across the foot around the outer part of the ankle and up the lateral part of the leg. The peroneal muscles in the lateral compartment of the legs. Okay, so that's